PCOS hair loss is reversible. Yes, you heard that correctly. When we talk about PCOS or PCOD, most conversations focus on weight gain, irregular cycles, or unwanted facial hair. But there is a silent symptom that many women suffer from in isolation, and that is scalp hair thinning. You wake up every morning and see many hairs all around you. You see that during shower or taking bath there are many hairs in your drain. And perhaps the most painful moment is looking in the mirror and seeing that your hair partition is getting wider and wider. You start to wonder, will I ever get my hairs back? I am Dr. Samiksha Tyagi, founder of Treatmedlogy Clinic. Today, I am going to share a clinical reality that the cosmetic industry often ignores. PCOS hair loss is not a life sentence. It is not permanent, provided it is treated with right science at right time. Stay with me till the end of this video because I am going to reveal a 3-step protocol that we use to help our patients reclaim their hair and their confidence. First, let's understand why hair loss is happening in PCOS. In medical terms, hair loss caused by PCOS is also known as female pattern hair loss. In body with PCOS, there is elevation of male hormones called as androgen, and the primary agent responsible is dihydrotestosterone or DHT. Now think as if your hair follicle is a tiny plant, and this DHT toxins the environment, that is the soil around hair follicle, which affects your hair follicle and their hair growth. First, your hair strand becomes fine and fine. In next phase, the growth phase of hair cycle becomes shorter, that's why they don't grow anymore. And eventually the follicle becomes so small that they stop producing a visible hair strand altogether. If you look at the research, around 30 to 40% of women with PCOD experience significant thinning of their hairs, usually between the age of 18 to 35. So this is a common age group when PCOS related hair fall is seen. But the important thing is the hair root is not yet dead. It is just dormant, it is sleeping, and it can be revived with treatment. So now let's move what actually works. I want to be very clear. Biotin gummies, multivitamins, expensive oils, these are not going to fix your hormonal issue. The problem is internal, so solution must be medical. At Treatmedlogy, we follow a triple action protocol. First, internal hormone stabilization. We must address the root. This involves stabilizing your insulin levels and managing your hormones. Medical research shows that 5% reduction in your body weight can improve hormonal balance, and even it can slow down your hair loss and hair shedding by nearly 50% because we are correcting the internal problem. Step 2 is medical stimulant. We utilize FDA approved topical lotions like minoxidil to increase the blood flow to the scalp. This ensures that the sleeping follicles receive the oxygen and nutrient they need to survive. However, this must be done under the doctor's supervision to avoid any side effects. The step 3 is the gold standard treatment, which is GFC. In this treatment, the transformation happens. Many of you must have heard about PRP, but at Treatmedlogy, we use growth factor concentrate, where while PRP contains platelet, GFC is the extracted growth factor from your own blood. It is highly concentrated and highly effective. When we use this growth factor to stimulate your hair follicles, they send a direct signal so that your follicles become thicker and your healthy hairs are again seen. The success rate with GFC treatment is usually 80 to 90%. Doctor, when will I see change in my hair? So you must know that hairs do not grow overnight. It takes time. Usually in first 1 to 2 months, you see that a significant decrease in active hair shedding. You will see fewer hairs in your comb. In next 3 to 4 months, the quality of the existing hair is improved and you can see a fine hairs emerging. By 6 months and beyond, you can see baby hairs which are growing and there is visible increase in thickness of the hairs. But for all this to see, early detection is very important. If you are grade 1 or 2 thinning, the results can be life-changing. But if you wait until a very long time, till your follicles are affected, then hair transplant becomes the only viable option. To summarize, PCOS or PCOD is a medical condition. It is not a flaw. It is certainly not your fault. You don't have to live with the anxiety of losing your hairs. Science has answers, and you just need the right roadmap for treating your hairs. At Treatmedlogy, we just don't treat hairs. We restore the confidence that PCOS often takes away. If you are struggling, don't wait for it to get worse. Click the link in the description to book a digital scalp analysis and online or in-person consultation. We will perform a complete analysis and give you your personalized hair reversal plan. Please share this video with any friend of yours who is fighting with PCOD. Knowledge is the first step towards healing. Stay confident and beautiful. I am Dr. Samiksha Tyagi and I will see you in the next video. Thank you.